Dr. Randall Clark, president of the American Society of Anesthesiologists, and Dr. Gurdev Rai, a physician anesthesiologist, joins us now to discuss the proposed change to the VA's standard of anesthesia care. We're happy to have you here today.
Thank you for having us. Right now, the VA is considering a proposal that would remove physician anesthesiologists from the operating room and replace them with nurse anesthetists. We think that's both unnecessary and unwise, and so we're bringing this proposed change to the attention of the public. We think through public attention, we can get this proposed change rolled back.
Well, what would you say, how are people feeling about the kind of care veterans should be receiving through the VA?
We know through surveys that more than 90% of the public agrees that veterans deserve the highest quality care in the operating room. We also know that across 95% of the population of the United States, anesthesiologist performed or anesthesiologist led care is the standard of care. We want to see that standard maintained in the VA system.
Definitely, and this is a huge military area as well. So what would you say then, well, not what would you say, what is the difference between an anesthesiologist and a nurse anesthetist?
Well, the training we've had as anesthesiologists, our training includes medical school, during which we learn alongside the future surgeons, the future cardiologists, future pulmonologists, and develop the team that's going to, in the future, take care of you when you're having surgery. So we have a critical role that is dependent upon our surgeons, and they in turn depend on us to provide the medical care during those cases.
Well, a similar change, though, was proposed, what you guys are talking about, happened in 2017. So what exactly happened then?
In 2016, the VA proposed to remove physician oversight of all 4 categories of advanced practice nurses in the VA system. But the reality is that for 3 of those are primary care specialties, and for nurse anesthetists, that's a critical care area in the operating room. After receiving over 200,000 public comments, the VA decided in 2017 to maintain physician oversight of nurse anesthetists while they gave what they call full practice authority to the other 3 categories.
And why was it so important for them to propose that change again?
We're not quite sure why the change was proposed. In the past, when it was proposed initially, many of us as chiefs of anesthesia within the VA system held a stop the line moment at that time, just to really emphasize how important it was to maintain, as we mentioned earlier, the standard of care for our veterans that the rest of our communities expect.
Right. So how does the proposed changes in anesthesia care compare to the anesthesia care available for most of the Americans, the civilians, I guess I should say?
Yes, great question. Again, 95% of the public live in states that require physician oversight of anesthesia care. And even in those states without specific state law, typically hospital rules will require that oversight. So what is being proposed is a huge dramatic departure from what most Americans receive and would expect. Okay. And we know that through our public opinion polling that more than 90% of the public agree that veterans should have this high quality care.
Right. And supporters of the change say it will help veterans gain access to care and save them money. So how do you respond to that claim?
Yeah, once again, in terms of access to care, anesthesia care and care in the operating room has never been a limitation to that access. There's never been a limitation specific to those things. Number 2, when it comes to access, it's important to understand you not just want to see a physician right away. For instance, if your child breaks an arm, you also want to ensure that they get the best possible care when they're seen.
Okay. And how can Americans help protect veterans' health and safety then? How can we all chip in?
We'd like everyone hearing this message to go on the internet to safevacare.org. There you'll see additional information on this issue and also links for sending messages to your federal legislators. We believe that they need to hear from you on the importance of this safety issue for the nation's veterans and to have the VA stick with the decision that they made in 2017, maintaining physician oversight of anesthesia care.
Wonderful. Well, thank you both so much for joining us today and getting out this important topic, and it's nice to learn about it. And if you'd like to see this segment again, just head to our website, firstcoastliving.net.